Welcome to More Than Words, a podcast about treating the whole child brought to you by the Reading and Language Learning Center. I'm your host, Tristen, and today I'm joined by clinical psychologist, Dr. Lisa Bennett, to discuss movement, structure, and scheduling for kids with ADHD. Hi, Dr. Bennett. How are you?
I'm fine. Hello. I'm happy to be here.
We're so excited to have you here. This is such a great topic, and I feel like probably at a good point in the year where parents are like, my kid's starting to have all the things. I need some assistance.
Certainly, choice of activities and cabin fever as it gets colder are all relevant to this population.
Absolutely. Well, let's start with an introduction. So tell us a little bit about who you are and what you do.
Sure. So I am a clinical psychologist, but I come to that title as a generalist. My very first job out of college was a preschool teacher. I then went to a combined school psych and clinical psych program. And as a PhD clinician, some of my first jobs were in broader settings like self-contained special education wings, forensic settings for youth.
Wow.
And then really for the last 10 to 15 years, I've been focused on private practice.
Yeah, that's awesome. What a wide range. I like that you said you're a generalist. That's such an insane amount of things to cover. It's really cool.
Yeah. Well, I think working with children, you have to understand the system that they're coping with, whether that's a
Yeah.
family system or a school system or an after school team. All of
Yeah.
this is understanding the child's experience.
Wow. Yeah, that's very important. I'm glad you mentioned that. So if people were looking to find your services, anything like that, where in the world are you? And then also online.
Sure. So I have varied roles. My general clinical practice for children presenting with therapy or developmental support is through MindWell
Yeah,
Psychology, which is in Chantilly, Virginia.
perfect. All righty. And for Mindwell's website, you guys are mindwell.us, right?
Yes, that's correct.
Perfect. Okay. So I'll pop that in the show notes and so people can, come and see you guys. So if you visited RLC's Chantilly location, you've been very close to Mindwell, so you can easily find them.
Perfect.
Perfect. Well, let's hop into this discussion today. This is going to be very, like I said, very relevant and I think helpful to a lot of parents. So, can we start off with just a basis, like I like to do with all of our discussions, which is can you give us a definition of ADHD so that people know what we're talking about?
Sure. So the understanding of ADHD really has evolved over time. The overarching understanding is these are kids, it's often identified by age 5 or 6, who have difficulty with executive functioning, which means the part of the brain that is the manager of attention is dysfunctional. So that can present in two prototypical ways. One is you have a very impulsive or hyperactive child who has a ton of energy and doesn't know how to regulate that or match that to contextual expectations.
Yeah.
Or you may have a bright child, but they don't know how to harness all that intelligence and they come across as inattentive or foggy. So you have
Mhm.
these kind of classic two poles of the ADHD diagnosis, which is the impulsive hyperactive type or the inattentive type. Certainly, there are many kids who have a combined mixed picture and they get the combined type as their diagnosis.
Yeah. Oh my gosh, you used a couple of things in that description that I felt like made ADHD so clear. Number one, I love that you said they're like the manager, like executive function
Mhm.
is the manager. That was so great. That makes all the sense. I feel like, especially for an adult in the workforce. And then I've heard the two definitions of hyperactive and inattentive, but I feel like the way you described inattentive, right? Like you have someone that's super bright that doesn't know how to harness all of that. It just was I
Mhm.
loved it. So I appreciate that.
Yeah, I mean, with kids themselves, when I am helping kids understand it's not a self esteem hit if you have ADHD, I will
Mhm.
say analogies like you might have a genius prodigy orchestra of musicians in your mind,
Oh
but
my
your
gosh.
conductor is on vacation. The
Oh
orchestra conductor is not there. So it's going to sound like a mess. It's not going to show up in school the right way, but you're a genius. We just have to
Right.
get the conductor working, and then it comes together in this integrated way. And kids usually sort of appreciate that analogy and that understanding that you
Yeah.
can be very bright and very talented and still have this struggle
Yeah.
neurologically.
Yeah. Oh, thank you. Again, I feel like it made it so clear to be able to like kind of picture that in a person, especially like if a parent is noticing those things in a kid. I feel like that cleared it up really easily.
That's the goal.
Exactly. So before we recorded today, or before we met to do this, we talked about this phrase of keep them busy.
Yeah.
And it sounds kind of just like parenting advice, right? Like that might be how it comes across. But we talked about how it's really a neurological basis for kids with ADHD. So, what does that phrase mean to you from a psychologist standpoint and also like a practical standpoint, putting that into everyday life?
Yeah, I mean, the issue of keep them busy, it really captures a lot.
Yeah.
I think it captures sensory issues for the individual child. So the child
Mm.
that needs maybe to move more or be stimulated more than another child. But it also is a macro dilemma
Yeah.
in society, which is right now there's this great debate about how much do we schedule our kids? How many sports do we keep them in? How busy should kids be? Is that a positive or a negative for kids? And it is, you can research positive and negative outcomes. And this has been given a lot of academic attention is how scheduled
Yeah.
up are our kids and what are the optimal activities that are positive for kids, and then when are you sort of overdosing kids on activities and sports. So
Yeah.
this issue of how structured a child's time should be, how physically busy they are, is debated.
Okay. Yeah. And like I said, I feel like you brought up a good point, especially in the Northern Virginia area. I feel like we're extra overscheduled sometimes. Might be
Yeah.
a hot take, but
No, I think it's fair, and we can explore this, Tristan. There's some
yeah.
macro data about the benefits of extracurriculars.
Mm.
Um, when you look at populations as a whole, but then you might also find there are smaller communities that are high
Yeah.
achieving, high pressure communities, and the degree to which they have their kids scheduled up might run into the range that it becomes overdosing kids on activities. And so
Yeah.
getting that balance right is really the nuanced, hard decision.
Right. Wow. So again, but a conversation we had before this was we talked about kids with ADHD having different gears.
Yes.
So from like high energy, which maybe is like a gear 4, to like calm, like recharging gear 1. Can you kind of explain that idea as a whole and how parents can start to recognize that in their own child?
Sure. So I think whether you're talking about ADHD from the hyperactive end of, I'll say spectrum, although that's a kind of loaded word, but the
Yeah.
hyperactive end to it to the foggy inattentive end to it, or
Right.
just any kid and their personality and their temperament, whether they're extroverted or introverted, whether they're sort of movement seeking or solitary, whether
Right.
they're big group kids or small group kids, right? I think when a question comes before me as a psychologist or even as a mom, which is how do I optimize this particular child's development? You
Sure.
have to understand that kid's wiring, right?
Yeah.
So if this kid is letting the world know they need to move and fidget and tap and squirm around, you might have a gear 4 kid. Or if you play into that as a strength and not a weakness and say, okay, let's load them up on motor activities, gross motor, fine motor. Let's see how they can take all that energy and turn it into a superpower.
Yeah.
That might be a really curative approach instead of just squelching that energy or seeing it as bad behavior. And on
Okay.
the other side of it, you might have a kind of low, mellow, introverted kid who does very well if they can crochet and have private time
Mm.
and they read a
Yeah.
ton of books, but they need low volume, they need low motor activity, and that's where they shine. And so, I bristle at any one prescription like it applies to every kid because we all are
Yeah.
wired differently. And so
Yeah.
to understand that motor wiring, that sensation seeking, extroversion, introversion. It helps you kind of see, well, what gear is going to best fit this child, and you program around that.
Yeah. I mean, I loved the crochet bit. I'm a knitter, so I can I can get into that.
Yeah. Yeah. I mean, and that's very mindful and curative for a lot of
Yeah.
kids, and it's private and introverted, but it's like a state of flow for a lot of children. It's just not, a D1 sports candidate. It's a different
Right.
kind of
Absolutely. And this
right.
is a little side note, but I really like to like knit and watch TV. And have you
Mhm.
ever noticed kids that use like knit, crochet, things of that nature to like focus their attention on something else a little bit better, or is it taking away attention?
No, this is the nuanced question of the day. So it's
Yeah.
really, again, knowing that optimal gear. Okay.
Sure.
So there was once a time where if you said the child is inattentive or
Mhm.
distracted, they would say, well, put them at a bland desk in front of a white wall and only let them focus on the book in front of them.
Oh
Okay. But
gosh.
if that's a gear 3 or 4 kid, they're going to stall out like a car they can't operate. They can't idle that low stim. It doesn't
Right.
work for them, right? So actually for that kid, let them listen to music, let them chew gum, let them tap a pencil, and then their brain is like, okay, okay, this is my gear. I know, okay, now I can do my homework, right?
Right.
So the idea that there's one sacrosanct mode for different learners, or one best context for attention, you really have to know the person and how much
Yeah.
stimulation gets them at their best gear.
Wow. And I really appreciate that you say that because I think people have this same notion that you were saying of like, well, if you're going to go sit and study, like it has to be this one particular way. But I love that you said get them into the right gear. I think the gear
Yes.
analogy is so great because it makes people realize like, no, no, this is where I need to be for my brain to be able to like zero in on the thing that I need to work on.
Precisely. So you think of kids that had to chew their pencils or would be like standing at their desk, their brain was telling them, you need this much juice to do this work. That
Yeah.
was a biological like mandate they were paying attention to. They weren't being
Right.
disobedient necessarily. Now how that, maps onto managing a classroom is a separate question, but I think we
Of
have to
course.
respect that everyone, is wired a little differently.
Yeah. Oh, that's cool. These are great analogies. It's making so much sense to me. So I'm hoping it's making sense to other folks that are listening. So we had talked about structure at the beginning of this, and I'd love to touch on that and kind of figure out like, why is structure so important for these kids with ADHD, and what does the helpful structure look like, and like when does it become too rigid or too overwhelming, I should say.
Yeah. Well, again, so I want to zoom out from that question and just talk
Yeah.
about, kids in general, and then you kind of you adjust that expectation for ADHD kids, whatever type of ADHD they may have. So,
Yeah.
um, there are these pendulum swings in terms of expectations about kids um, after school, after school activities, extracurriculars, sports, evening time, and all of that.
Mhm.
And I will fess up and admit I come from one extreme pendulum swing, which was I was a kid in the 70s and 80s. I was a latchkey kid. We call ourselves like the feral Gen X generation. We just did it our own way. I mean, we were
Right.
just out there in the neighborhood riding bikes around, no
Yeah.
grown-ups, right? And there were some positives to that, but certainly that can also invite risk factors. And I would
Sure.
say culturally, the cohort of parents has swung to quite the
Yeah.
opposite. That the expectations now are that kids are pretty scheduled up,
Right.
whether it's arts or sports or what have you, that there's an expectation, there's an extracurricular activity,
Right.
and there's an adult present, and it's supervised, and there's a method in that activity.
Sure.
So I appreciate the polarity,
Yeah.
but I will say so you go and you do a little research and you say, well, what's better? People will
Right.
kind of plant a flag that they're on one side or the other. There are good studies and models that having kids do structured growth promoting activities supervised by an adult is largely a positive thing.
Sure.
So in Iceland, there was this study about, I think in the 1990s, it was a study in Iceland that has now been called the Iceland Model. So they
Oh,
found that their teens in Iceland were drinking more and abusing more drugs than a lot of their cohort in other countries.
wow.
So Iceland got on it. I mean, it's easy when you're in Iceland to have a whole national um,
Absolutely.
initiative because it's one space. But they did
One
this
space.
great big initiative, and they said teenagers will now be enrolled in arts and sports, and adults will
Ooh,
be there, and we're going to schedule them up, and we'll see the benefits. And the benefits were
sure.
dramatic. So
Wow.
between the 1990s, and I have the data available, between the 1990s,
Yeah.
teenagers in Iceland who reported being drunk within the last 30 days was at 42%. And then they scheduled up their teenagers and got them in all these activities and by 2016, it was down to 5%.
Oh my gosh.
Massive effect size. So this is why this one model of like keep your teenagers busy has had a lot of juice.
Wow.
Yeah, dramatic. And even, daily smoking, and there's been cultural shifts about expectations with smoking, but daily
Right.
smokers for teens went from 23% down to 3% through
Oh my
this initiative in Iceland, right?
god.
So the idea of
Wow.
keeping kids busy is a lot of things. It's keeping them physically healthy, it's keeping them supervised, it's keeping them growing, it's keeping them socializing, it's also keeping them away from antisocial behavior or drug use.
Mhm.
So there's a lot of benefits to it.
Yeah.
Um, there's also a study that was done in the US around 2012 when this started to be debated. Are we overscheduling kids?
Right.
And I think it was called looking at the overscheduled hypothesis. And even
Mm.
in that study, they said we did a time diary of 1,100 kids and we
Oh,
saw
wow.
how intensive are they scheduled. And even with that, they said the data showed that the time intensity of involvement in activities did correlate to positive outcomes like psychological flourishing or grades going up and the like. And there was just no statistical relationship with negative outcomes, say depression,
Wow.
anxiety, sleep deprivation, grades going down. So those are two kind of macro studies. If you look at the whole population, right? Kids who do a lot of activities and kids who don't, that
Right.
show that it's pretty beneficial to keep your kids in supervised, structured growth promoting activities and
Yeah.
pretty protective against risk factors.
Right.
There's a lot of debate though. There's a lot of other journal articles that look at the extremes where kids feel overscheduled, and we can talk about that.
Yeah. Well, I love the Iceland study, and that is like an interesting population to pull a study from because I mean, they you like you said, they're just themselves.
Right. It's a contained sample.
Yes.
Yeah. Yeah.
Wow. So I'm curious about like you said the overarching theme is positive. Like there was not really a negative correlation in the macro studies that you had mentioned. But I am kind of curious if for those kids that felt like they were overscheduled, what was it that made them feel overscheduled?
Right. Right. So then I think you're looking at kind of the poles of the question. And so let's say
Yeah.
you have a child who is from a high achieving community where there's an expectation that your parents went to an elite college or you will go to an elite college, or when you play sports, it's not just for fitness, it's to get to travel or get to
Mhm.
recruitment. Or grades are related to advanced placement and being tracked to take college level courses.
Right.
That cohort, there is some evidence that if you overschedule those kids who are already high achieving and have high expectations for perfection or
Right.
elite status, both academically and in extracurriculars, the toll of that can be felt.
Yeah.
It's a high achieving attitude about childhood. And there are kids who will pursue achievement to the detriment of their mental health, to the detriment of their sleep count.
Right.
And it starts to become that question of like, well, what's the sweet spot where you encourage a kid's growth as much as you can up to the point where you're just overdosing them on these expectations.
Yeah. And I mean, I am a kid that grew up in the Northern Virginia area, and so
Mhm.
I did also witness, like, this kind of culture, where I feel like that happens a lot more here than I feel like this is anecdotally, I'm not speaking
Yeah.
to research, but it does feel like it happens a lot more here than in, other places in the US. Um, so it's interesting to hear, like, of course, that there has been research done, and those are the things that are the stressors. It's more the fact that there's expectation put on so many things, and then, like, the extracurriculars can't just be fun.
Right. Right. I think it's like a bell curve, like any other expectation, that there's a lot
Yeah.
of room in the middle that's like normal and okay and makes a ton of sense. It's when you're in either end of the bell curve, a child who has no one present and is just free range from 3, say, to 10.
Mhm.
And what does that look like? And there are now new risk variables for unstructured time if you're only on screens or you're
Wow.
sedentary. Now suddenly we're all looking at that. That the unstructured child, if that means screen time, boy, that brings this whole nother range of research that everybody's looking at.
Oh,
And so
yeah.
that's one end of it. And then the other end is the highly structured, physically demanding, like student athlete picture and what they may feel and the stress they're under.
Yeah.
And, candidly, some of the challenges, like, is it okay to bring parents and kids just back to center and say, okay,
Yeah.
what's a reasonable homeostasis?
Yeah.
Where's your peace and your productivity, and how do we balance that? And that's work for each family and each child to decide.
Yeah. And do you for the parents that are, like, listening to this and they're like, "Wow, I that's what I where I wanna be is, like, back to center." Do you
Mhm.
have any recommendations for them of, like, how to get back to that sweet spot, or, like, what things to notice where you're like, "Okay, this is an alarm bell, like, we need to pull back from this or add more to that."
Yeah. Yeah. Well, certainly as a child therapist, I try to give parents a script for feelings check-ins.
Mm,
So that just like a dinner time conversation, a couple open-ended sentences said to kids on the regular can be really powerful. Like to say to
okay.
them, I'm proud of blank, but I feel overwhelmed by blank. Or this week something felt like it was too much. What might that have been? Or I wish adults understood this week my struggle was blank.
Mm,
And to not forget to ask that question tangibly and wait for an answer, you
yeah.
know, not just text a message real quick, but like sit there with them and ask them that question. Notice the subtle signs of retreat or withdrawal. If you have an overscheduled kid, if they're souring on a coach, or they feel like there's toxic coaching, if they're afraid to tell you they need to quit something that is
Mhm.
overwhelming them. Part of a kid figuring out how they are a master at something is knowing what they're going to also let go of. So when that kid
Yeah.
knows, I'm not a lacrosse player, I'm a band kid. You've got to let that kid have a moment to express that and say, it's now time for me to focus and become an expert in this thing I feel called to do. And that's not bad. It's the
Right.
focusing is how you go through high school is figuring out your lane. They're not letting anybody down by saying it's time to have a reasonable exit from this activity that's no longer meaningful to me.
Right. Wow, that's important. I do feel like people are in 12,000 different places. And so I'm
Yes.
glad you mentioned that of it's okay for one thing to take a back seat. Like you're going to now focus on being your expert in the thing that you really enjoy.
Right. And the expectation, this goes to the, normative population or the ADHD population, that we're all well-rounded and good at everything. I mean,
Yeah.
what adult do you know who feels well-rounded and good at everything? Like, I'm as good at cleaning my
Yeah.
house and talking to children and paying my taxes and running a marathon. No one we
No.
all narrow in and we self-select into like 2 or
Yes.
3 things we're good at. And then
Right.
that's who we are, right? So
Yes.
if you have a 15 or 16-year-old who's giving you those signs, like
Yeah.
it's a necessary ending with soccer or with music or piano, listen to
Right.
that, because
Yeah.
we're all supposed to find a more narrow lane as we move into adulthood.
Absolutely. Yeah. I want to talk about something that I keep referencing stuff that we talked about before, but I do want to hit on this because it's kind of like a physical activity, which we've talked a bit about. And I'm curious, I think you've had some experience with this. So we talked about Taekwondo before we got to
Hmm.
this point of talking to each other here. And you said that it can be particularly therapeutic.
Hmm.
So what is it that makes activities with clear structure and progression, like we've kind of been talking about this, but like martial arts, drumming, um,
Right.
band, soccer, all the things that makes
All of
it
it.
effective for kids with ADHD?
Yeah. So I'll say a couple things. One question I always invite parents to ask is if there is this exceptionality about your kid. And the word exceptional can mean negative, they're on one end of the bell curve, or positive.
Right.
And you will sometimes hear this term of twice exceptional kids. So you might have a
Yeah.
kid who's very, very bright, but they have a gap and they can't get phonics and they're dyslexic while they are also bright. Or a child who's very bright and also ADHD or what have you. You can have any kind of combination of exceptionalities.
Right.
So I do like to flip that as an expectation and say, well, what if that exceptional quality is like a superhero or a
Mhm.
superpower that we want to capture? So if your
Yeah.
kid moves all the time and it's hard to keep them in line or keep them in circle time, well, how would you program for that child if that were actually their superpower?
Ooh.
Right? So maybe
Yeah.
that kid needs to do something physical in the morning and expend a lot of energy or be a year-round swimmer.
Right.
Or, I raised a child who had a lot of hyperactivity and he was always tapping and fidgeting with his hands, and we put him in snare drumming and that became his standout talent. We just were like,
Wow.
okay, he's got to move this way. Let's turn it into a superpower.
Yeah.
Um, so to not squash it, to give it a little bit of space and room and see it maybe is not a problem, but a special talent. So that sounds a little Pollyanna, but there is room to think about that critically.
Yeah.
Um, and I do think movement is also great for self regulation with
Yeah.
emotion.
Ooh, yeah.
It affects serotonin levels. There are kids who need to move in the morning. Um, you just have to kind of get to know the neuromuscular and sensory demands that will optimize your child's wellness
Right.
in a very specific way. And that's a mouthful, but that is sort of the task,
Yeah.
right? Like know what they need to do, how they need to move, how they are sensation seeking, what gear they're in, and then think strategically as parents and teachers about, well, how do we make this work for this little person or teenager?
Yeah. Yeah, I love that. I as an adult have always noticed like if I can get some kind of workout in and it doesn't matter like how long it is or how intensive it is, but just something where I get to move like at the end of my day, I'm like, "Oh, well now it doesn't seem overwhelming to do the rest of my evening." Feels
Right.
like I can do that. It's pretty normal.
Yeah. Yeah. And for some children, that might be being in choir
Yeah.
or getting on a canvas and doing fine art. And you kind of try to optimize that outlet for them.
Yeah. And you hit on another one of my things, which is choir. Love choir. I
Yes.
was the choir kid all of my years.
Amen. Yeah. I mean, that should not be minimized either.
Right.
Um, Singing and the performing arts in their own way are athletic too.
Yeah.
And they demand a rigorous stretch of
Yeah.
skills. If you're memorizing a script, if you're doing an audition and you have the fear of not making the cut for the part,
Oh, yeah.
if you had a bad rehearsal, if a performance you made a mistake, all those little character lessons people feel on the field after a loss or needing a pep talk from the coach, they really do translate to the performing arts too. And I always
Yeah.
hope people give that equal emphasis.
Oh, yeah. We got to have someone on to talk about, like, mental toughness, and
Hmm.
he works for, a university and is really more in the sports realm, but
Hmm.
I remember and I didn't really do sports growing up, so it was an interesting conversation, but it did feel like, oh, I could take any of these things and, like you said, apply them to the performing arts and apply them in other areas because it's just the mental toughness that you're like working on,
Right.
regardless of what field it's in.
Yeah. Yeah. And I was an artsy kid too, but I will admit this, having never played a team sport of any kind, I give myself a almost cliche post-game football talk to myself after
Oh
I make
yeah.
mistakes because there is a culture to the world of sports that therapists need to listen to, which is
Yeah.
like you see someone interviewed in a football game after a loss and they immediately say what they're grateful for. I was out there with my team. I put it on the field. I tried hard. I recognize what I did. Here's how I need to grow. We're going to focus on this for the next game. And they kind of loop it back into a growth moment.
Yeah.
It's remarkable if you start to like look for this
Wow.
on newsreels with sports. I'm like they're doing therapy right there. That's a cognitive reframe after a loss, and it helps them with
Wow.
grit and resilience. And they're like, "This is what we do, and we rebound, and we'll come at it next week a different way. And I love my team, and I'm grateful to be out here, and I'm going to give it my all next time too." And wow, like that's really something to be captured for the intellectual world of talk therapy.
Wow. That is so cool. I never thought about it like that. Oh my gosh. But you're so right. I mean, at the end of every game, you just watch them say, I did this well. I'm gonna work on this. Like, cause there's I often think with sports, like there's no hiding from like a mistake in your job, like for
It's
them.
transparent. Yeah.
It's so transparent. Everyone has their own opinion, which like that is a side note, but like it's very obvious to see where there was an issue, like on the field, on the court, anything of that nature. So for
Right.
like you said, for them to be able to sit there and say and very quickly recognize, like, this is the whatever mistake I made, but this is where I did great, and to just move on from there.
Yeah.
That is so cool. I'm
And
glad you
there's
mentioned
and
that.
there's almost always in those little interviews on the field, there's something about connection, which is like, I
Yeah.
love my guys, or I'll work harder with my team, or here, I'm so grateful that my coach gave me this feedback. There's
Right.
something about attachment in those little post-game interviews too that
Yeah.
is quite therapeutic and meaningful. So
Yeah.
there's a lot of overlap between arts
Wow.
and therapy and sports. There's a lot of
Yeah.
good stuff.
Oh, that's so cool. Well, now everyone needs to, like, at the end of every sports game they watch, like, pay attention to what's
Listen up.
happening.
That's
How
right.
cool. I want to 'cause I have a bit that I wanna focus on, which is I wanna touch on medication because that is a big thing with ADHD as well.
Yep.
There are a couple schools of thoughts, but then I also
Mhm.
wanna ask you about you had mentioned your own kiddo putting him with the snare, and,
Yeah.
I kind of wanna talk about your experience in that way too.
Sure. Sure.
Mm,
So I will share. So
yeah,
as a psychologist and also a mom of a child who is recognized as, markedly hyperactive.
right.
Um we did a little bit of, I think it's fair to say we tried a bunch of approaches.
Yeah.
Um and my experience as a mom of an ADHD kid, I think matches what my clients report. So when there's a decision about medication, I think it's fair to say you're looking at three categories in a kid's
Mm,
response to meds. And I'm a PhD, I'm not an MD, but I've observed this in feedback from my clients.
okay.
So there is a good amount of data that I've read and have used in you know justifying referrals to psychiatrists or pediatricians for meds, which is that a class of meds, which is psychostimulants, and how they help ADHD kids is quite dramatic in its
Mm,
effect size.
yeah.
I remember being at conferences and sitting next to psychiatrists, and they're like, next to antibiotics, like stimulants being effective for ADHD are right up there. Like it just works. So
Wow.
you'll hear that opinion.
Yeah.
However, I would think that I always say, look at three categories. One is yes, for a few kids, if you find the right dose and the right med, often psychostimulants, but now there's a blend of medicine
Mhm.
and different avenues for action at the molecular level, different categories of meds that work for ADHD. It's not just
Okay.
what it used to be, which was like Ritalin and Concerta. It's a broad array of choices now. and I would defer this conversation to an MD. But I would
Sure.
ask parents to, as we track it, look at one, is it a silver bullet? And like immediately they metabolize this drug. You see an increase in focus and self control. The teachers usually notice it inside a week or two. They're like, something's
Right.
working, something's changing, and you get that feedback.
Right.
So that's one category. Another category I ask people just to look at is, are you seeing no difference? Like, are you paying for this medicine and asking your child to take and tolerate this medicine, but you're really not seeing the benefit? So it's just kind
Right.
of a nothing burger result. So sometimes that happens.
Yeah.
And then there are cases where this is another category. I just ask them to look at this. Are you seeing any side effects? So there
Mm,
are certainly documented side effects of some of these medications about appetite reduction
right.
or too much stimulation, a dose that's too high, difficulty um, relaxing at night, or rebound effects when the meds wear off. Those are some of the side effects that you want parents to feel prepared to examine and discuss with their prescribing physician.
Right.
So largely understood to be an effective category of meds, an
Yeah.
important intervention to try for kids with a critical eye that you're looking at effective, not effective, or side effects.
Right.
Um, but also to say a lot of parents are very, very cautious about
Yeah.
introducing medication. And they're
Right.
like, they want to try everything that seems kind of holistic or natural first. This is a discussion, again, they should have with an MD. But
Hmm.
I do invite parents to think about their kids' gear and how do we understand this child, their wiring, and how do we program a day around how much motor activity they need to expel or how
Yeah.
much time they need to regroup and harness their attention, what
Right.
wherever they are in their ADHD struggle, have we looked at that just behaviorally and through activities and planning
Right.
to optimize their development?
Yeah. Well, that's a great way to answer my I know I didn't really give you, like, a real question, so I appreciate you just going with me on that.
Sure.
But that's a great way to look at it. I feel like parents are often looking for just, like, a "Do I do medicine or do I do no medicine?" answer.
Right.
Um, but you can't, like, give that. That's, like, not a realistic thing to be able to give, so I feel like you gave some really good ways to, approach that.
Yeah. And most important, again, because I know my scope of competence, I'm not an MD, is really to get good advice from a child psychiatrist or a pediatrician. But often what happens is that person is then not the person tracking it day to day. They've
Yeah.
prescribed the meds, and then the teachers are giving you feedback, or the therapist is seeing the kid weekly. And so
Right.
getting that team to talk to each other and see what is helping optimize the child's development is key.
Yeah, that's awesome. So, I don't know if you have any other experience of raising your own kid that you wanted to hit on?
No, I guess I think it's fair to share that I had kids who they did operate at different gears.
Yeah,
One, I had my son who was a gear 4 kid and needed activity all the time. My daughter, I would say, is more of a contemplative, solitary person when she needs to get her work done. And they
yeah,
just needed a different, if you think of like setting up a study environment, whether
right.
noise is allowed or not allowed, whether you should be interrupting them or not, just let your kid be an individual and
Yeah,
and think about, how do I optimize their profile? And every kid's going to be an individual.
yeah, that's cool. So let's say um we've got our schedule that we think is like locked. We feel comfortable, we feel like we know where all the things should go, right? Like
Hmm.
motor activities in the morning and quiet time for this or whatever.
Hmm.
Um, what happens on a day when that schedule seems to fall apart and it feels like there are no things that are working?
Right. Well, I mean, honestly, the advice to the parents is
Yes.
to just take a breath and forgive yourself and, just honoring that you are, running a household, just running a household, right?
Yeah.
Just getting some bags packed, getting kids out the door, meeting basic needs. You're already doing a good job.
Right.
This kind of minute dissection of doing everything perfectly as a parent is as
Mhm.
crazy making as what we put kids through, that they should
Yeah.
have an A+ in every single thing.
Right.
No one can do it,
No.
right? And actually, there's something growth promoting about leaving a kid facing a mess or leaving a kid feeling bored and they have to decide how to entertain themselves or
Right.
asking them, work with me here. I can't get your lunch to you. How do we solve this problem?
Yeah.
Those little moments of mess are also moments of growth. So
Wow.
give yourself some grace. That's how they become adults.
Yeah. I like that. I kind of like the concept of allowing kiddos to just work with the problem as well, like problem
Yeah.
solve with you. Because sometimes it feels like if you give them all the answers, then they go to college or they go off and they join the workforce, and they're like, wait, my mom always fixed this for me, or my dad always
This
did
is
this for me.
suboptimal. What is going on?
Right? You're like, wait a
Yeah.
second,
The world is suboptimal. Right.
correct?
Yeah. Yeah, I mean, I really think, every mess up, every mistake, every maybe even a late drop off is always a
Mhm.
learning experience.
Yeah, yeah. Well, I think that was my last thing for you, like in terms of super big questions, unless you had anything else you wanted to touch on.
Yeah, no, I think we cast a broad net. I know we were
Yeah.
talking about, how much to schedule a child at the start, and then it invited these larger questions.
Yeah.
Um, I hope parents keep that idea of a bell curve in mind. And so
Yeah.
if you are setting very high expectations, let's say you have a kid who's doing pre-Olympic ice skating training and they're in all honors classes and you
Oof.
expect them to get a good night's sleep every night, the
Oh,
parent does have to kind of do an inventory on how realistic those expectations are. I do think the parent is responsible to consider that.
right.
But there's a lot of room in the middle where we want kids to be shepherded around adults, keeping them safe, staying busy to prevent negative outcomes that is quite healthy.
Yeah, absolutely. Well, this has been so interesting and I think incredibly helpful. And I said this before, but I think well timed. I feel like the middle of the year, you start to like notice if the wheels are falling off.
Or maybe they're humming and working perfectly. Isn't that nice?
Exactly.
Right.
Yes. All of
Yes.
that would be great. Amazing. Well, thank you so much for being here. This has been such a great discussion.
Great. Thank you for having me.
Absolutely. Thank you so much to the audience for listening. Make sure to subscribe and leave us a little rating and review. It helps other folks find the podcast, and we'll chat with you next time.